Let's talk about something that's on a lot of dog owners' minds, the health of their best friend's heart. In this explainer, we're going to break down a condition called DCM and really get to the heart of what it means for our big-hearted dogs.
Have you ever been out playing with your dog and just had that little thought in the back of your mind, that they seem to be slowing down a little more than you'd expect? Or maybe they get tired on walks that used to be no problem at all.
If that sounds at all familiar, trust me, you are not alone in wondering about it. Today, we're going to talk about why that might be happening. We're going to dive into a heart condition called Dilated Cardiomyopathy, or DCM for short.
All right, so first things first. What in the world is dilated cardiomyopathy? What does that big name actually mean for your dog's heart? Okay, so in simple terms, DCM is a disease where the heart muscle itself just gets tired and weak. The muscular walls of the heart, especially that main pumping chamber, the left ventricle, they become thin. And when they get thin and weak, it makes it so much harder for the heart to do its most important job, pumping that oxygen-rich blood out to the rest of the body.
Here's the best way I know to explain it. Think about a brand new elastic band. It's got that great, strong snap to it, right? Well, a heart with DCM is like an old, worn-out elastic band that's been stretched one too many times. The muscle becomes big and floppy, and it loses that essential snap it needs to really push blood out effectively.
So the next big question is pretty obvious. Which dogs are most likely to get this? And the answer? Well, it's a mix of a few different things. We're talking genetics, breed, and even diet.
DCM definitely shows up most often in our bigger canine buddies, the large and the giant breeds. For a lot of them, there's a really strong genetic component, which just means it can be passed down from one generation to the next.
And the list of at-risk breeds is pretty specific. We see it a lot in Doberman pinschers, Great Danes, and Irish Wolfhounds. Boxers and Newfoundlands are also on that list. And it's not just the giants. Some medium-sized dogs like Cocker and Springer Spaniels and even Portuguese water dogs have a known genetic risk for it too. Now, beyond their genes, what a dog eats can also be a factor. Years ago, we figured out a link between low levels of an amino acid called taurine and DCM in American Cocker Spaniels. And more recently, you've probably heard about the investigation into a possible link between DCM and what some people call BEG diets. That stands for boutique, exotic, and grain-free foods. These diets often use a lot of peas, lentils, and other legumes. The exact connection is still being studied, but it's really put a spotlight on how important nutrition is for heart health.
Okay, knowing the risks is one thing, but what should you actually be on the lookout for at home with your dog? Let's talk about the signs and symptoms.
And here's what makes DCM so tricky. A dog can actually have this disease developing for months, sometimes even years, without showing a single outward sign. We call this the occult or hidden stage, and that's exactly why being aware of the risks and doing health screenings can be so important for these breeds.
The very first clues you might notice are usually super subtle. We're talking about things you might almost brush off, like maybe they just can't handle those long walks like they used to. Or you might hear an occasional little cough. In some cases, there might be a very brief fainting spell. We call that syncope. Sometimes you might even notice a bit of weight loss that you can't really explain. These are those quiet little whispers that something might be changing.
As the disease gets more serious, the signs become a lot less subtle. And these are the signs that mean the heart is really starting to struggle and they need immediate vet attention. You're looking for rapid or heavy breathing, even when they're just resting, a cough that sounds wet, a belly that looks bloated, or a bluish color to their gums or tongue. These are all red flags.
Seeing those signs can be really scary, I know, but the next step is actually a positive one. It's about getting answers from your vet. And that can feel a little intimidating, so let's walk through what you can expect.
So, your vet is going to be your partner in this. It usually starts with them just having a really good listen to your dog's chest, checking for any murmurs or funky rhythms. Then, they might suggest chest x-rays to see how big the heart is and if there's any fluid in the lungs. An ECG checks the heart's electrical rhythm. But really, the gold standard test is a heart ultrasound, an echocardiogram, because it lets the vet literally see the heart muscle pumping in real time.
You might even see something like this. For some of those at-risk breeds, like Dobermans and Boxers, vets often use a special device called a Holter monitor. It's basically a little ECG machine your dog wears for a full 24 hours. Since weird heart rhythms can come and go, this little gadget is amazing at catching those problems that might be the very first hint of DCM.
Okay, so you have a diagnosis. That can feel like a really heavy weight. But what happens next? This is where we shift our focus to management, and more importantly, to hope.
Now, it's really important to be upfront.
For most of the genetic types of DCM, there isn't a cure. But, and this is a big but, that doesn't mean it's the end of the road. Not at all. The entire goal of treatment is to manage the symptoms, slow the disease down, and give your dog the absolute best quality of life we possibly can.
The treatment plan is usually a combination of different medications, and each one has a very specific job. Diuretics help get rid of that extra fluid from the lungs. ACE inhibitors help relax the blood vessels, which just makes the heart's job a little easier. There's a really key medication called Pimobendan that helps the heart muscle squeeze more strongly. And then we use antiarrhythmics to get any of those irregular, dangerous heartbeats under control.
So what does the future look like? Honestly, it really varies depending on the breed and, crucially, how early the disease is caught. The great news is that some dogs, especially the ones diagnosed in that early hidden stage, can live for several years on medication and have a really wonderful quality of life. It just proves that catching it early makes all the difference in the world.
We've gone over a ton of information, I know. But if there is just one single thing I want you to walk away with today, it is this.
Early awareness. That is your best, most powerful tool. By knowing the risks for your dog's breed and just paying attention to those small changes in their energy, you become their #1 health advocate. Nobody knows your dog better than you do.
Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.